Hello everyone, I hope you're all doing well. Welcome to Minashi Physio. Today we are diving into a fascinating case study in the field of physical therapy. Let's start with the patient's history. Okay, a 60-year-old female patient with a history of diabetes mellitus presents with progressive weakness and a sensory loss in both lower limbs over the past 6 months. She reports difficulty walking and a feeling of numbness in her feet. On examination, there is a bilateral lower extremity weakness, decreased proprioception, absent ankle reflexes, and a sensory level at T10. The patient also demonstrates urinary incontinence. Which of the following condition is most likely causing the patient's symptoms? You have four options in front of you. The first option is Guillain-Barré syndrome. The second option B, is multiple sclerosis. Option C, diabetic neuropathy, and the option D is transverse myelitis. You have to select the best answer based on the presented case study within 60 seconds. Okay, I hope you have selected your answer and have also mentioned it in the comment section. So this case study suggests that the most likely condition causing the patient's symptoms including progressive weakness, sensory loss in both lower limbs, absent ankle reflexes, sensory level at T10 and urinary incontinence would be transverse myelitis. It means option D is the correct answer. Now let's analyze why other options are less likely compared to transverse myelitis in this case. Okay, so let's talk about the first option, GBS, Guillain-Barré syndrome. It typically presents with a rapid onset of ascending weakness starting from lower extremities and ascending upwards. A sensory level and urinary incontinence are not typical features of GBS, so this could not be a best option in this case. Next option is multiple sclerosis, MS. It often presents with relapsing remitting neurological symptoms. While it can cause sensory and motor deficits, it rarely presents with such a clear-cut sensory level. Additionally, urinary incontinence might occur in advanced cases but is not a primary feature of this disease, so it also couldn't be a best option in this case. So the next one is diabetic neuropathy. As we all know, it is a common complication of diabetes causing peripheral nerve damage. However, it usually presents with symmetric, distal, and slowly progressive sensory and motor deficits rather than a clear sensory level at a specific spinal cord level. So in contrast to all, transverse myelitis typically presents with a sudden or subacute onset of motor weakness, sensory loss, and a clear sensory level due to inflammation of the spinal cord, often leading to urinary dysfunction. Given the case presented symptoms like sensory level and urinary incontinence, transverse myelitis is the most likely diagnosis among the options provided. If you want to understand transverse myelitis in simple words, then this part is for you. Transverse myelitis, often known as TM. This condition might sound complex, but don't worry, I am here to simplify it for you. Let's dive into a story to understand TM. Imagine your body is a big bustling company with a central communication hub called the spinal cord. Now, this spinal cord is like the company's main communication system, responsible for passing messages between different departments smoothly and quickly. One day, something unexpected happens in this company. There is a disruption in the central communication hub. It's as if the mail room suddenly gets clogged and slowed down. Because of this clog in the mail room, the messages within the company start to get mixed up or delayed. Some departments receive incomplete or confused instructions while others don't get any messages at all. This disruption causes chaos within the company. Some departments start experiencing issues. They might not function properly or might even shut down temporarily because they are not receiving the right messages. In real life, transverse myelitis is like that disruption in the communication hub, the spinal cord. It is when there is an inflammation or damage to the spinal cord affecting the transmission of messages between different parts of the body. In our company's analogy, let's explore what might cause this disruption in the mail room likened to the cause of transverse myelitis. Just like various factors can jam up the mailroom, transverse myelitis can result from different triggers such as viral infection, immune system disorders, or even certain autoimmune conditions. These factors are like sudden roadblocks that can unexpectedly disrupt the flow of communication in our company. Now, consider the symptoms as the indicator that something is really wrong within the company. When transverse myelitis occurs, it sends signals similar to the red flags in our story. Individuals might experience symptoms like weakness, numbness, tingling sensation, or even loss of bladder or bowel control. These symptoms are aligned to the warning signs that the department or body affected by the disrupted communication system are not functioning correctly. Additionally, there are certain risk factors that can make some departments more susceptible to this disruption. Conditions like multiple sclerosis or certain infections increase the likelihood of experiencing transverse myelitis, just as some departments might be more prone to feeling the effect of the maelstrom disruption due to their proximity or reliance on it. I hope you wouldn't forget it now. If you like the video, please like, subscribe and share. See you in the next video. Thank you.